you're talking about how can we actually help different segments of the population to go through this crisis. So, for example, youth. Let's start with young people. With young people, the two biggest challenge a lot of them are facing, even before all these crises, are housing and also employment. As we talked about at the Youth Empowerment Conference last year in Brunei, a lot of youth are going to experience more redundancy, they're going to experience more unemployment, they're going to be on shorter contracts than all the generations before. So there's a lot of uncertainty. Socially, their biggest challenge is going to be mental health and social media. And I think those two are interlinked to some extent. Mm-hmm. So, how do you engage younger employees? How do you engage younger clients, your target audience, your customers who are young people? How do you mobilize them? How do you engage them? Like you said, they're very evolved. They're very socially conscious. How do you tap into that energy and make it innovative, make it a lot more progressive for your company? I mean, during the good time, if you didn't want to try anything, fair enough. But during crisis like this is where you can be innovative. This is where you can ask yourself, how can we be more sustainable to take this company over the line? So mobilize them, basically give them opportunities to extend themselves. Mm-hmm. And for those people who are unemployed, we just got to be a little bit more understanding of these young people being unemployed, and stop, give them a lot less hard time. That's all I'm saying. I mean, I wouldn't want to say, just enable these snowflakes and say, you'll be fine. You got to level it to them, tell them, this is how the new world order is. What do they want to do? Have that really constructive conversation. And then we look at the next segment, which is the older people. Right? The older people in your workforce and in the population. It's going to be tough for them, really, because the shift to technology, not everyone is comfortable with that, and also apps and applications and software, they just upgrade it and they change all the time. And for some older people, change is just really uncomfortable. And so just got to be very understanding that you have to reskill them, you have to re-educate them. And not only that, is there any other way to use and tap into their experience, right? Because they've been around for a long time. They've gone through many different crises. So tap into that and see, if you could use them, or you could actually mobilize them for some sort of crisis response team or future planning team. So, they've seen it many times, and some of them would even realize that, okay, this is what happens when a crisis hits. They feel it up. Human beings are pretty smart. If things happen to you a couple of times, you also tend to realize what are the telltale signs. So these are the things you can form working groups where they can work with young people, where they can work with middle executives. And if any red flag come up, they could highlight it to the C-suite executive. So everyone brings to the table very different
play a role,
qualities. Yes. So you just have to really help them out. And it's also a scary time. And also in this crisis, people of that age group were the biggest hit as well. So they're frightened. Yeah. And no, they're high risk. The older people who are, during this coronavirus crisis, the older people are high risk. So they, they can get affected very easily. And if things don't get detected early, they can deteriorate really fast. So this is also a reason why you see a lot of high fatalities or high deaths. The numbers fall with the older people, which brings me to the next point. As you're aware of, in the States and also all around the world, the kind of people or the kind of the segment of population that gets affected most by this whole entire crisis are the poor. Mm-hmm. Those people who can't afford healthcare. So it's also important to understand why this happened, and are we going to continue to let this happen, or are we going to do something about it? So again, this is another conversation altogether, but it goes to public sector policies, healthcare policies. What do governments do? What can private sectors do to work with the government to help provide these facilities? And I think most importantly, a lot of these care economy people who are nurses, people who are social workers, they tend to be not getting paid really well. They tend not to get paid really well. They tend to be not that highly respected in the society as well. So we need to re-gear ourselves and think about all these people. Like, they're the ones who deliver the food to our doorstep. They're the ones who are going to clean the road, clean the tables, clean the train stations and so on. If you do get sick, you go to a hospital, the nurses are going to take care of you. If your family member pass away, or if your friend pass away, you go to see a social worker, or if you're under stress and going through anxiety, the social worker is going to help you. So, during good times,
putting their life on the line, isn't it?
Absolutely, they are the front line. And yet we don't appreciate them. We don't regard them very highly in the society. And because of that, their pay are usually not good. They don't have permanency or even security with their jobs. So, we need to really rethink as a society of rewarding them, giving them proper pay. I mean, it's all great that, we see all this cities clapping, and giving applause to all these healthcare workers every night in 7 and 8 p.m. I wonder, when times return back to normal, how many of us will still remember the contribution they make,
so
to our lives.
Cost into something very practical, their wages.
Yeah. So this is another thing. And there's another thing I want to add, which is another segment of the population, women. So more than 70% of healthcare workers, social workers tend to be women.
Mm-hmm.
And yet gender pay gap is a very real thing. For the same pay that women and men are working in the same job with the same qualification, women have to work 100 days more than men. Why? Because there is a gap. There is like a 20 to 30% gap. In the whole world, Iceland is the only country in the world that makes gender pay gap illegal. So it's not like there's no such policy in the world, there's no such legislation. There is. It's just up to us to be conscious about it. A lot of women do stay at home, and they contribute to a large extent to the care economy. Mm-hmm. So they take care of their spouses, their children, and all that is unaccounted for, and all that is unpaid. So by the end of their working life, studies have proven women are earning a lot less than men. And also, because they're earning a lot less than men, they put aside a lot less superannuation, which means by the time they retire, they're going to be 30 to 40% in terms of funds less than men. So these are just some of the things that we need to be aware of. And finally, the last segment of the population I really want to touch on is the migrant workers. Right. Okay, so in a lot of first world countries, the migrant workers are not just the ones who clean your house, to chauffeur you around. A lot of the migrant workers are actually working in, guess where? Healthcare, mm-hmm. hospitals. And it's the same in Singapore. I'm not sure in Brunei, but in Singapore, you see a lot of nurses, a lot of dental assistants or medical assistants. They're all from either Philippines or Indonesia or Thailand or even India. So again, if you look at the news in UK, for example, some of these healthcare workers who died after taking care of people, right. Because of this crisis, they are actually migrants. So it's not funny to be racist. And if you see someone being racist, if you hear someone trying to shift blame to Asians because people are so ignorant, then you need to call them out. This is not the time to blame each other. This is another curious thing, H1N1, when it was spreading through America, no one has called this the American disease. But yet, when this thing came out, it's really interesting to see some world leader in the world, being really fixated at calling it a China virus or a Wuhan virus. I think that needs to stop. I mean, we are all in this crisis. We need to help each other. Creating division is not constructive, yes. Because all it does is it confuses the general public. The information that they receive are different. So one day is you don't have to wear a mask. The next day, you have to wear a mask. One fine day is like, you don't have to worry about it. You can go out and shake hands, and the next day you end up in a hospital. So this is my point. So as a leader of a country, of a sector, or even as an entrepreneur or a social entrepreneur, you need to be able to lead, and you need to be able to lead with clarity, and you need to appreciate different segments of the market and see if you can turn them into some sort of engagement opportunity, how you can contribute. Everyone is different. Every company situation is different. So say, for example, some of my clients, they have factories, for example, in Singapore. And when you look at manufacturing industry, most of the factory workers, production workers tend to be nowadays mainland Chinese, right? So a lot of these migrant workers are stuck in Singapore. They can't go back home. They're worried sick. They want to see their family, but they can't. In the meantime, they are facing the fear of facing the livelihood of getting made redundant. And the living cost in Singapore is not exactly cheap. And not only that, a lot of these workers, they want to be able to do something. In fact, a lot of them actually step up and say, yeah, we're happy to contribute. We're happy to even take a pay cut or no pay for like a couple of weeks just to do this. And if you look at their wages, it's truly really little. So as a company, as a corporation, I would encourage people to look into their conscience and see if there's anything they can do to help their workers, to help those people who are going to be hit the biggest. And
their living quarters are, not exactly safe because so many people staying all together.
Absolutely. It's not just in Singapore, like in Australia it's the same. So the government is giving all these funds to people who are losing their jobs. It's called a job seeker package, or this rescue package, where they issue a bit of funding to individuals who have lost their job, and so that it can tide them over. So apparently it just came out a couple of days ago. Migrant workers are not covered by that.
Mm.
And when we say migrant workers, we're not just talking about the working class. I mean, it's also white collar as well. So one of the person I know from volunteering, she's from India. She works for KPMG, and she's been asked to basically take a pay cut, and because of that, she can't pay her rent, and she's not entitled to job seekers, or she's not entitled to that rescue package. So these are just some of the things that we need to be aware of, but specifically migrant workers who work in the medical and healthcare sector.